Welcome to the Wellness Surge podcast with Dr. Adiola Oke. Each week, we discuss our wellness journey with real people like you and me. We have conversations about food, fitness, mental health, financial wellness, and much more, so you can get back to the real you. To make sure that you're up to date with this and other wellness topics, visit wellnesssurge.com. Information presented here is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of the information presented here without first speaking with your primary care provider. Now, let's head on to the show.
Hello, everybody. Welcome to the Wellness Surge podcast. My name is Dr. Adiola Oke, and today I have Dr. Dipo Masha. And today we're going to be talking about sometimes what you need is someone to listen to. So, hello, Dipo. Say hello to everybody.
Hello, everybody.
All righty. So Dr. Dipo Masha is a family practice provider in the United Kingdom. A large proportion of his weekly consultations involve mental health issues, right? So as a primary care practitioner, to be able to manage a physical symptoms, he also needs to be able to manage the mental aspect of things, all right? So I kind of introduced you, right? When people come to you, most of the time they come with a physical ailment, right?
Yes.
But sometimes the main thing is mental. So based on your experience, what is the state of mental health in the world?
So I think one of the most important things is to define health. And when you define health and you use the WHO, which I think is one of the best definitions of health, is that it's the complete physical, social, mental well-being of an individual and not just the absence of infirmity. Most people think that if you don't have high blood pressure, you don't have diabetes, you don't have a malignancy, you're healthy. But if you don't have a very good mental well-being or social well-being, you're not very healthy, and that can affect your physical well-being. One of the ways, certainly in primary care, for us to understand and completely appreciate people's health is not just by asking them, what the physical problem is, but to understand what their ideas, what their concerns, and what their expectations are. And when you ask an individual what their ideas, concerns, and expectations are, you'd be amazed or surprised as to the other things that they come up with. So someone telling you that I have a headache, it may turn out that the problem is they don't have enough support at home. They've been feeling low, they're feeling anxious, work is a bit overwhelming. Those things come into play from a social and mental aspect to impact on their healthcare. So a tension headache, for example, is usually due to stress. And the stress may be coming from depression or anxiety. So mental health and physical health are certainly very much intertwined. You asked me a question. I think I went through very long way.
That's okay, because it gave us a better understanding of health, because you're absolutely right. People think, you don't have high blood pressure, you don't have diabetes. I don't want to listen to anything else again. Full stop.
I'm fine. Yeah. But when we talk about, the state of mental health in the world, I can't answer that with confidence. But what I can do is give anecdotes or stories about mental health in places that I have experience in. So in Nigeria and Ghana, and certainly in the United Kingdom. When it comes to places like the United Kingdom, certainly, and most countries actually, mental health is not giving as much credit. But unfortunately, there are setbacks, because certainly social care is also affected, which affects mental health. If you don't have good housing or you don't have that recreational facility, there are a lot of people with mental health problems that depend on that. You take that away, it affects mental health. So there are pros and cons with the United Kingdom with respect to mental health. When it comes to countries like Ghana, Nigeria, and certainly maybe a lot West Africa or Africa and a whole, and maybe parts of the Middle East, mental health is certainly not as advanced as places like the United Kingdom. In Nigeria, for example, you still have Victorian laws whereby committing suicide is a crime, and you wonder how that makes any sense, but it's there. Same thing in Ghana. Most of the mental health in the United Kingdom is, as we said, practicing primary care or at a more local level. In Nigeria, Ghana is practicing secondary care or tertiary care, so you have to go to hospital to get that. And if you're seen to be going to hospital there, you become persona non grata. People know you've gone into a mental health facility. Yeah, you're stigmatized. So, these things are there. So the mental health in the world is not one thing. It depends on culture, it depends on where you are. from a cultural aspect, and you would know if you're from an African point of view, people don't like talking about these things. You know, it's like it doesn't affect me, or they don't think it affects them until it probably does. And if it does, people shun you. You become not part of society anymore. How can you be depressed? What are you depressed about? That does not make sense. Your life should be better. From a religious aspect, people also say the same thing. You're clearly not religious enough. That's why you're depressed. You know,
That's just
so
ignorance. That's
exactly.
just
So you have that. So culture, religion, what have you, can affect the way we perceive mental health. And that's certainly changing in places like United Kingdom. And it is changing in the world, but it depends on where you live. And I think that's one thing you have to appreciate. It's a cultural, national, religious. It does depend on where you are for mental health to be perceived in whatever way it's perceived. And I think that's the most important thing. Know the environment you're in before you can apply whatever it is you want to use in that environment.
Absolutely, absolutely. You were talking about in places where people are like in denial, right? About mental health issues. And it just reminded me of even just the coronavirus, right? And people are like, oh, you have the coronavirus. Stigma.
Yeah, exactly.
And it's
Yeah.
just like people don't even want to go to the hospital, don't even want to acknowledge that there's something wrong with them, and then leads to detrimental health effects. And so if you can catch it early, like the coronavirus or whatever, if you can catch it early, you may change your luck, right? So that's what just came to mind when you were talking about stigmas and people say, oh, you don't have it. I'm just like, yeah, it happens with so many other things too. Even I'm sure high blood pressure. Unless numbers don't lie.
Absolutely. People will say stuff like, I can't have high blood pressure. I am that religious. So
I'm
I
just
come from
stressed out today.
Yeah, you know, or my blood pressure, pops up today and tomorrow is fine. People have different ways that they look at things, and unfortunately, you just have to educate them for them to understand. You can't just force things on people, and I think that's the most important thing. Just keep educating people.
And that's why I thank you for being here, because the whole purpose of this is to educate people to reduce the burden of chronic diseases that we're facing around the world. So thank you.
Yes.
Thank you so much
You're
for being
welcome.
here. I appreciate that. All righty. So we now know what health is. We now know the state of mental health, right? So what can we do about it, right? How can we effectively manage this?
Well, from a point, and I appreciate from where you come from, it's always about trying to use well-being, wellness to manage things, and medication maybe last. And certainly with this particular bit, I'm certainly much with you. And as I said, my conversation with you is going to be very anecdotal. So it's going to be a lot of conversation about different stories I've experienced. Now, there are different ways to manage mental health. And I think one of the things you have to know is what kind of mental health problem the individual has. So it could be depression, it could be anxiety, it could be substance misuse. Mental health even goes to psychosis from schizophrenia and what have you. But I think when we talk about mental health a lot, especially in this day and age, a lot of it focuses on depression and anxiety, suicidal ideation, and substance misuse. From a point of how you manage it, you can use medication. So different sorts of medication, SSRIs, TCAs. I'm sure some of your viewers may not get that, but they're medication. So I'll leave that.
I'm a pharmacist. Okay, believe me, I'm a pharmacist. I'm all for medication when you have to. But my only thing is always like, I feel so bad because side effects, because.
Yeah, absolutely. So I'll get there. So that's what I was saying. I'm with you in this particular thing, and I'll give you stories about my approach to managing mental health. So I've had different people come to me, oh doc, I feel low, or doc, I don't know what's going on. So you explore the ideas, concerns, and expectations. And the ideas is, I feel low, someone thinks I'm depressed. Okay, what are my concerns? What's affecting my family and my relation with my family? What are my expectations? Well, I like a medication to make me feel better. Perfect. Now we know where you start from, we know where you want to end. How can I manage this? If I would do an assessment, I think you might be depressed. Okay, how depressed are you? Moderate, mild, severe. Okay. What do you need as backup? Is medication required or not? My first point of call when it comes to management is usually self-CBT, so cognitive behavioral therapy. How do you think, and how does that thinking affect how you're going to manage yourself? If you appreciate you're depressed, great. It means that you're already insightful. So you're already one step in managing yourself. What can we do about it? With a lot of my patients, what I do is we write down. Unfortunately, because of COVID, I don't see a lot of people face to face. But when I did, I'll have sticky notes on my table. And I used to divide things into you, workplace, maybe family and friends. What can you do about yourself? What can you do about work or whatever social activities, and family and friends? What can they do for you, or can you appreciate that? With you, it'll probably be, how can I exercise more? How can I stop feeling negative about myself? Things like that. With work, can I take a break? Can I take annual leave? Can I take study leave? Can I get occupational health to, get me some sort of therapy? With family and friends, who do I talk to? When do I talk to them? Who can support me? If I can use all the resources around me to manage myself, then I may not need medication. And I've had a patient with similar situations whereby this individual was able to use these things I provided for her to avoid medication.
That's
On the
really
opposite
good.
way, I had another individual I was like, let's try this. And he was like, no, I prefer medication. I'm like, absolutely, that's fine. But what I do is I tell them, if I put you on medication, I'm always worried. And I say this, that you may not get off it. And I prefer if you weren't started on medication, but if you want it, that's fine. We can look at it later and maybe avoid you having to be on medication for the rest of your life. And one of the doctors said that if you ever want to get a patient off medication, never take them off in the winter. It's just going to get back, because if a place like Scotland is really, really dark in winter. So also, that's how you manage people. You manage them based on what they want. You manage them on what you know. You manage them on, it has to be a two-way street. Both of you have to manage together. If it's a doctor-centered approach, it may not work, especially in mental health. If it's patient-oriented only, it may not work, because they may put them in danger if they say, I only want medication, and they don't want to talk about their. So I think from a management point of view, there's also, we talked about medications, also electroconvulsive therapy, which I've seen once. So another story, this was in Ghana, and it was a lady, and this is what I'm talking about how we perceive mental health. It was a Muslim lady, and the reason why this is important is because she didn't want, she was very depressed, but she didn't want to commit suicide, i.e., by taking a poison or killing herself directly. She decided that she was going to go on journeys whereby she thought that the route were dangerous. So just in case something happens, she can get into an accident and potentially die. This was the way she wanted to kill herself, because in her mind, as a Muslim, if I commit suicide, I go to hell. So that's she basically said, I don't want to affect my religious aspect, but at the same time, I don't want to be in this world. So because it was so severe, she required electroconvulsive shock therapy, which is used. I mean, if it's very severe, you can't do anything about it. People. Your brain is a bit shocked, and the idea is to release some hormones to help you feel a bit better. And this is where I talk about culture and religion affecting the way you may act. And one of the things that actually, and this is probably an example, is that religion and culture sometimes can be protective, not from mental health problems, but from suicide. So you see, less likely to commit suicide because I'm worried that I will go to hell because I'm a Muslim. You see, so these are, or I'm a Christian. This is how people perceive things. So these things, family, religion, a good working environment, these things can be very protective. Having children, what have you, can be very protective. Because when we speak to patients, especially suicidal patients, we ask them a question. What are your protective factors? Usually say, oh, maybe my job, or maybe my children, or maybe my wife, or maybe my husband, maybe my mom, what have you. So it's very important that we explore this. And just talking about suicide, I think is just important to bring up. So the Samaritans and the group that sends to helplines that help people when they feel very low, they came up with a study in 2019 saying that the most common cause of death, which is quite interesting, in men under 55, it's suicide. And clearly there's a link with depression with that. And one of the problems with men, especially at that age, or even any age, is men, we don't like talking. Because we don't like talking, we keep everything in. And when the canister decides to explode, It really does explode. So that was, I mean, the fact that under 45s have a high rate of suicide amongst men is telling. And then women are more likely to maybe attempt suicide, but they're very unlikely to complete suicide. So these are the things that we need to know from a mental health point of view, how we protect ourselves, how we protect our family, knowing the signs, knowing the risk factors for suicide, because the ultimate reason why we talk about mental health a lot is we're worried that people will harm themselves, even if it's not to commit suicide, but certainly harm themselves, and harm themselves in a can be quite brutal way. So it's important that we remember that.
Okay, so you said a lot, so thank you. All right, so what I'm getting from this is this. It all depends on the severity, but a good place to start is let's, like with a qualified person, try to evaluate the different aspects of your life that could be protective or could be contributing. Is that right? Right? Like
Yes, absolutely.
work, family, what do you want from them? What can they do for me? I never thought about that like that. And I really appreciate that, because when I actually work with patients, too, its bottom line is, what do you want? Are you ready to go the easy route or the longer lasting route, right?
Yeah.
So are you ready to do like the work and try to work on your diet and exercise and stuff? Or do you just want a pill? So
Yeah.
stuff. If you want a pill,
Yeah.
it's all good.
It's
We'll
all
go
good.
on.
Yeah. Yeah.
It's all good.
But you have to remember that everybody wants the easy way. Obviously, if I can feel good by taking the pill is great, but I have to give you some information to let you know, as you said, side effects. I have to give information to know that. And a lot of people eventually say, you know what, maybe I can come off this pill. Maybe I can come off that. Maybe I don't want to get on it. I don't want to be addicted. You know, they use all sorts of words, and you have to give them the information that they need. And I think that's why the ideas, the concerns, the expectations is very important to know, so that you guys can meet somewhere halfway, quarterly, whatever.
They thank you after a while. They're like, you were so hard on me, blah, 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 but thank you. Like, because they finally achieved that goal that seemed so impossible. So yes, that's exactly what I'm getting from here. So that's a lot, right? And so in this day and age, right, everybody around the corner is popping up with, I'm a certified this, I'm a certified that. Okay, so what should we look for in somebody willing to help manage your mental health?
I think when you're looking at someone to manage your mental health, you have to look at somebody that is able to listen to you and talks less. They need to hear you. They need to understand what you're about. They need to be non-judgmental. And it's very important that someone is perceived as non-judgmental. So you can say, I'm not judgmental, but you have to be perceived as non-judgmental. So when someone tells you, you know, I think about, I don't know, smoking this substance, or I use this drug, or what have you, people look at them in a funny way. Or I abuse this, or I've tried to self-harm. You have to be willing to appreciate that this individual is suffering. And I remember I had there's a condition of being not bipolar, borderline personality disorder. Now, if you've ever met anyone with borderline personality disorder, they're very, very, they have a very, very chaotic life. Very, very dependent on people, but they're also very chaotic. And they're always wanting to sort of say, conversation with someone with borderline personality can be quite frustrating, because sometimes it doesn't make sense too much. Someone told me once, see, if you appreciate something about people with borderline personality disorder, you won't probably get as frustrated as you do. They're suffering. Think of them as suffering. And if you think of them that way, your judgment of them, your irritation, your judgment, all that stuff goes away, because you look at them as, well, this is a condition. It's not an act. Yeah, sure, they come to A&E every week with something. But do you think, honestly, they would want to be doing this if they were well? Clearly, there's something going on. So look at them in that way. And that's where the non-judgmental, it's very difficult. Even as doctors, it's very difficult not to judge people. When someone walks into your consulting room, the first thing you're doing is judging them. You're looking at their appearance. Do they look clean? Do they look well shaven? Do they look well dressed? Do they smell well? You're judging them. You're always judging. But to be perceived as non-judgmental is what the act is. It's very difficult. When someone says something and you react, or your eyebrow goes up, you have to challenge yourself and do that. And that's one way people trust you, by you not being judgmental. And you have to offer practical help. So saying, "Oh, I've heard you. It's all good. Yeah, yeah, fine. Okay, that's good." Or, I think it was a comedian that was talking about, and he was joking, and he said, a woman can call another woman as friend and say, "Oh, I'm lonely. Can we hang out?" And she's like, "Great." Another man does that to another man. He's like, "No, leave me alone. I'm not hanging out with you." And that is what I mean by practical help. And that's probably why women are more likely to get support, because men don't, they're not as emotional or intimate with each other as women would be. And the practical help is that someone calls you out of the blue and says, I'm struggling. Maybe all you need to do is sit down with them. And this is from a family and friends point of view. From a professional point of view, just telling somebody that I'm here. And because of COVID, I've noticed a lot of things. Patients will call you and they're struggling. A lot of people are struggling. They don't even appreciate that they can call you just to have a conversation about that they're struggling. Not for help, not for a solution, just to say that. And I had a conversation with a patient once, and I think she was struggling. And I think she was asking about support at home and all of that. And she's like, "Well, it's very difficult. My husband is working. I'm having to be a teacher at home. This is new for a lot of parents, just having to homeschool and have you." And I'm like, "Okay, so any support?" Like, "Yeah, but it's difficult because he's working and I can't just keep asking him." I'm like, "Okay, why don't you do this? Write a letter. Write him a whole letter. Explain how you're feeling. Sometimes when you say something, you might not be able to express yourself as well. So write a letter so he can read it. Now, maybe the first time, and don't be very hard on him when you're writing it. Just let him use it to express yourself so he understands how you're struggling. Tips like that help people because they, as much as you may think it's an easy thing to do, just, "Oh, that's quite logical." People don't think that way because it's a fog in their head. And practical tips is very, very good. Even from a medical point of view, just telling people, write a letter, telling people, go for a walk. I don't know, have a coffee somewhere, go out to your house, go for a run. These are practical tips that helps mental health, because if you're stuck in your house doing absolutely nothing, sleeping, waking up, doing sleeping up, just telling someone go for a walk, they may not realize, maybe if I go for a walk, I'll feel better. So practical tips helps. And I think you have to feel comfortable around the person that's giving you help or you're talking to. If you don't feel comfortable, it's very difficult. So for example, people will say that I can't go to a religious leader with to talk about this because they might judge me. So go to a friend, go to a teacher, go to a classmate. But certainly if it's somebody you need professional help, go to somebody, go to your doctor, go to your nurse, go to your social worker, go to your AA meeting if that's something. So these are places you can seek help from a professional point of view.
All righty. Well, thank you. That was thorough.
Yeah.
Appreciate that. Okay. All righty. So you have said a lot today and we appreciate you. We appreciate your time. So what is one thing that you want to make sure that people take away from you today if they did not even learn anything? I have learned a couple of things. But what do you want to make sure people learn and take away? One thing.
I'll say one thing. You're not alone. I think that's the one thing I would like to take away. And when I say you're not alone, I mean in the sense that it affects not just you, it affects a lot of people, but also you're not alone in the fact that there are people that can help you. So if you feel that way, that you're not alone, you're not alone, I think you would appreciate that there are ways for you to seek help. There are other people in your shoes who have been able to get through this. And there are people that are out there that are able to help you. And you not being alone is very, very important for you to know that there are people to help you and there are people going through the same thing you're going through and are able to survive it.
I absolutely love that. So listen, people, you are not alone. Other people have gone through what you're going through, and there are other people that are willing and happy to help you. All right, so thank you. That was good. You are not alone. You are not alone. I'm putting it on my wall that you're like, you are not alone. You can totally do this. All righty, Dipo. Thank you so much for coming all the way from Scotland.
You're welcome.
All righty. I hope you all have a wonderful week. And I'll see you in the next show. Take care. Bye-bye.
Join our Wellness Search Facebook community so that you can implement what we learned together. I am because you are. Thank you for listening and sharing your precious time with us. If you enjoyed the show, then follow us and subscribe on iTunes, YouTube, or any app that carries podcasts. Have an awesome week. Best wishes to see you thrive.